Chapter 35, Family Interventions. So let's start off by talking about family structure, and you do need to be familiar with these terms. You first have your nuclear family. These are children living with two married parents. Then you have single parent families, which is children living with a single adult of either gender. You have unmarried biological or adopted family, and these are children living with two unmarried parents or their adopted parents. A blended step family. These are children living with one biological parent and that parent's spouse. Cohabitating family. These are children living with one biological or adopted parent and that parent's unmarried cohabitating partner. Extended family. These are children living with at least one biological or adopted parent and at least one related non-parent, such as a grandparent. Then you have grandparent family. These are children living with one or both grandparents. A childless family. These are partners living together without children. And then other. These are children living with related or unrelated adults who are not biological, such as foster parents. So there are various family functions. Management includes power, resource allocation, and rule making. Boundaries. These are individual distinctions between members. So clear boundaries are adaptive and healthy, with each member understanding their boundaries. Diffuse boundaries are unclear boundaries, and there's a lack of independence with members becoming overly involved with one another. And then rigid boundaries. These are closed boundaries with demanding adherence to rules, which results in little sense of loyalty and isolation. Now, communication. Healthy communication consists of clear messages and members sharing feelings openly and honestly. Dysfunctional communication includes manipulating, distracting, generalizing, blaming, and placating. On page 621, box 35-1 gives examples of dysfunctional communication. And then socialization. Family is the first example of socialization that a person has, and it helps you understand roles. So the Merchant family consists of parents Trent and Marnie, and their two daughters Morgan, age 13, and Heather, age 9. Mr. and Mrs. Merchant are seeking family therapy because they are having trouble helping Morgan, who has ADHD, cope with stress and social situations. Her anxiety and frustration sometimes manifest as panic attacks that can look like aggression. These attacks set off panic in the parents as well, who compound the problem. Marnie says, because we just can't find a consistent right way to handle it, so we just wing it every time. A second response to the stress in the Merchant's household is a certain overprotectiveness that they describe seeing in their younger daughter, Heather. In general, they've noticed that Heather tries to compensate by being very well behaved, like almost abnormally so, says Trent. We think she's trying to protect us from more stress. Marnie nods. Sometimes, on rough evenings, she even takes control of dinner time, ordering pizza or making hot dogs for dinner when we're focused on Morgan, and she's only 9 years old. It's cool that she's so sweet, but we also feel bad that she even thinks to do that. The family has come to rely on 9-year-old Heather to initiate dinner preparations when her sister is having an episode. Although this can be positive, it does mean that they run the risk of violating ordinary family what? The answer can be A, boundaries, or D, management. Children should not be forced or expected to take on this responsibility for their family. So what are the major goals of family therapy? And that is to improve the skills of individual members and to strengthen the functioning family as a whole. So first we have cohesiveness. This is how much time do members spend together as a family unit. Communication. Do the members respectfully listen to one another's concerns and ideas and allow for open discussion when a disagreement arises? Appreciation. Do the individual members contribute in meaningful ways to the functioning of the family and offer gratitude to one another that supports self-esteem? Commitment. Do the individual members consider the impact of their actions on the family as a whole and in a manner that promotes unity? Coping. Do the family members demonstrate the ability to support one another during times of crisis? And then collective beliefs and values. Does the family identify with or practice within a collective moral, ethical, or spiritual set of standards? So, models of contemporary family therapy. Contextual therapy gains insight into problematic relationships. Family of origin fosters differentiation and decreases emotional reactivity. Experiential existential therapy guides the family to identify and develop their own solutions to dysfunctional behavior. Structural therapy improves family relationships through restructuring the family hierarchy and boundaries. Strategic therapy realigns family hierarchy through use of rituals which change repetitive and maladaptive behaviors. And cognitive behavioral therapy, CBT therapy, improves patterns of negative behaviors through changing thought patterns. We are going to talk about CBT therapy throughout the entire semester. Now, the table here on page 622 gives more explanations. So, concepts central to family therapy. You have the identified patient. This individual typically is regarded by family members as the problem, the black sheep, the family member whose beliefs, perceptions, actions, and responses demand an immediate fix. Sometimes this is known as the family symptom bearer. And then triangulation. Triangulation occurs when one family member will not communicate directly with another family member, but will communicate with a third family member. So the nursing process, we're going to talk about this again throughout the entire semester. But let's start with assessment. A genogram. A genogram is a visual representation of a person's family, relationships between members, and medical and mental health histories. It is more in-depth than a family tree because it provides more extensive information about the family and each member. And you can see this here on figure 35.3 on page 625 and also the handouts you were given in class. But there's also needs to be a self-assessment because the nurse should be mindful of their own personal background, their family of origin issues, and styles of interacting, as these can affect how the nurse responds to the patient. Now, your nursing diagnosis you can find on page 625. Here is a list of them here in box 353 that are family related. Outcomes identification. This is where you work with the patient and the family to develop outcomes. Planning. Anytime you're planning, safety needs will 100% every time be your priority. Implementation and intervention. Implementation is where you provide counseling using a problem-solving approach. You make treatment plans that are clear, and you give each member a chance to express feelings while you listen. Family psychotherapy may be necessary, which is a form of talk therapy aimed at improving relationships and managing conflict among family members. And then your evaluation. Basics includes increased knowledge level and improved family coping. At an advanced level, it includes the level of family and member functioning, reduction in conflicts, and improvement in communication. And then your treatment modalities. There are many different types of psychological therapies which will be discussed in more detail in your upcoming chapters, so we're not going to dig down into them here. But I do want you to be familiar with the role of your advanced practice registered nurse because they conduct family therapy, they apply family therapy to specific disorders, and they help with substance use disorders, child behavioral problems, marital relationship distress, and as an element of the treatment plan for schizophrenia.